Center for Parish Nursing education series, our Zoom, that we want to begin offering as our quarterly educational series. So this is our second one. We're really grateful for our speakers today and grateful for you to join us for this. Just to let you know a few housekeeping things, that Amy will be muting everyone's except the speakers so that we can, there's no background noise and we can have their full attention during this presentation. And also it will be recorded and it will be uploaded to our website. So if you want to, if someone was not able to be here today and you want to refer them to that site to hear the message today, you can do that. And we're also going to work on trying to get it over on YouTube so that we can have that access for you too, as well as the PowerPoint. We'll put that on our website too. So we're just really glad that you're here today. And I would like to open up our time this morning here with a prayer reflection. And this is called A Prayer for a Pandemic, which I thought was quite appropriate for where we are this year. The author of this is unknown. So if we could pause for just a moment now as we reflect on these words and for our prayer today. May we who are merely inconvenienced remember those whose lives are at stake. May we who have no risk factors remember those who are our most vulnerable. May we who have the luxury of working from home respect and support those who must choose between preserving their health or paying their rent. May we who have flexibility to care for our children when their schools close remember those who have no options. May we who have to cancel our trips remember those who have no place to go. May we who are losing on our investments remember those who have no money to invest. May we who settle in for quarantine at home remember those who have no home. During this time, when we cannot physically wrap our arms around each other, let us each find ways to be the loving embrace of humanity to our neighbors. Be aware, be accepting, be supportive, and be kind. Amen.
Amen.
Well, it's my pleasure today to introduce our speakers today for our presentation. And first we have Jan Gaddis, who is a faith community nurse for over 24 years at Franciscan Health, working with Holy Cross Community as their parish nurse for 20 years in pastoral leadership role until 2018. She is currently in the outpatient palliative care department at Franciscan, providing spiritual care support to their patients, families, and staff. Jan's passion of integrating faith and health, nursing, and spirituality, she will share with us today. Our other speaker today is a DNP student that's been working with Jan. Her name is Lori Hacker. Lori is a registered nurse and certified adult geriatric primary care nurse practitioner. She received her training from the University of Indianapolis as a faith community nurse in 2006 and has served in various roles in health ministries and faith community nursing with Hoosier Harvest Church. She is a member of Research Committee of Faith Community Nurses International and co-chair of the Practice Committee. She will complete her Doctor of Nursing Practice student at Touro University in February. Her DNP project is Advanced Care Planning in Faith Communities, and she has partnered with Franciscan Health Indianapolis Parish Nurse Program. She is a nurse faculty with Indiana Wesleyan University and works in community-based palliative and hospice care. And it's my great honor and pleasure that I turn our program over today for Advanced Care Planning in Faith Communities to Jan and Lori.
Thank you, Barbara. That was a nice introduction. And as we open and start our program today, this comes from Lori and my work together. Look at how can we help increase advanced care planning in the congregational setting. So it was originally for faith community nursing, but we want to reach out to the faith leaders now, to health ministers, and the pastoral care. So faith community nursing will tell you a little bit about that, and health ministry is about that integrating of faith and health in the nursing and spirituality. But I want to start with talking about palliative care and hospice care, because that's where we situate advanced care planning besides looking at community-based. And then we'll talk about advanced care planning, why it's important, and different types of advanced directives. And then Lori will particularly share her project. It's about the resources for faith leaders and health ministers. And then if anything else comes up, we talk about the spirit leading. So we'll see what happens. So as she said, my background is pediatric nursing. So I worked with children at Riley Hospital who were dying years and years ago when I first started nursing. So I think it's been that palliative care has been part of me for my whole career. But it's looking at the whole person care, providing that spiritual care, the caregiver support, looking at, again, that integration, faith and health. It's about being with people on their journey for healing and wholeness. It's about that ministry of presence and how to be. It gives permission for meaningful conversations about healthcare. So we know we have lots of conversations, but it's those meaningful conversations that are deep down. And we give that attentive listening to them with compassionate care, joyful service, which instills hope, and particularly in this time of our world of such illness and despair and distress. We know there's still the good is out there. Faith community nursing and my work is at Holy Cross, looking at being an advocate and then help navigate resources for the individual, for families, for the community. We help improve the quality of life and living and being present with them in their journey. We like to help educate, empower persons who have serious illness to help self-manage, but then also the self-care of the caregiver, the minister, the faith leader, the nurse. We build relationships. It's about building those trusting relationships, making the connections and being of service. And then that promotes the resilience so that we can keep coming back, promotes that health and healing. So then Lori, this is Lori. You want to say hi, Lori? We worked together on this project, and it's been a very big blessing to do this. So thank you, Lori, for being here.
Thank you.
So I'm going to talk first, what is palliative care? So we've maybe hear about hospice care and then palliative care, and it's confusing what it is, and end-of-life care. So looking at palliative care, that's offering whole person care, particularly maybe if they have serious illness. Not just at end of life, but diagnosed with a serious illness. And it helps improve that quality of life, that quality of living, helps talk about what their wishes are, what their goals of care, what matters most. So having those meaningful conversation, what matters most. And we can do that at the congregational level. We can do that before they get sick. But we also have formal palliative medicine that have practitioners who go out to have these conversations too. And to talk about the advanced care planning and what the treatment preferences are. We give support for any kind of symptoms. We help alleviate suffering. It does include control of pain. We help also to help bridge to hospice when they're ready, when they meet criteria. So it's a bridge. And it's an approach that we use an interdisciplinary team, which means the physician, the nurse practitioner, the providers, social work, the nurses, volunteers, chaplains, clergy, neighbors. So it's whole person care, looking and support. The goals of palliative care then affirms life and regards dying as part of that normal process of life. It doesn't hasten or postpone death. It helps alleviate symptoms, distressing symptoms. Again, integrating spiritual care, psychological care, emotional care, looking at that whole person. It's a support for the family, the caregivers, the patient, whoever's involved in that family system. Increases the comfort, gives extra care, extra TLC, has a plan of care to meet the patient's need, and the person who's the driver of that plan is the patient, gets to say what they want. Formally, palliative care is made through a physician, your primary care, perhaps doctor, to make a referral for palliative care. Then hospice care is focused on maintaining that quality of life also, but providing the comfort and help with symptom control for life expectancy, for a person whose life expectancy is more limited. They may say 6 months or less is typically what you hear, but it's not set to a time limit. It provides, again, that whole person care for spiritual, emotional, cultural support for the person, for the caregivers, for the family. So it's getting, again, looking at the whole system, the whole person. And it's for the person maybe with the terminal illness that has chosen not to continue with treatments. So it's not looking at curative, not looking at curative treatments now, but rather looking at comfort care, looking at quality of living, of how to live until that last moment. And there are guidelines specifically through Medicare Part A for Medicare that meets criteria. So a person can't just say, okay, I'm ready to die and I want hospice. You have to be certified by 2 physicians, and it's a Medicare benefit. Other insurance companies cover it also, right? So we're looking at the goals, again, having that dignity, the peace and comfort as we transition to the next life or to the end of this life, however a person sees. But in our tradition, particularly in the Christian tradition, we're looking at the eternal life. So how do we transition from life to eternal life? Allows that person to have control of how they want to be, if they want to be alert, of course they want to be comfortable. So it gives that kind of support. Again, the interdisciplinary team supports everyone, and it attempts to keep the person in their home setting. So if they're home, if they don't have to go somewhere to get hospice, it comes to them. Or if their setting is the facility or assisted living, it helps support there. So again, just looking there to compare palliative care and hospice care, with palliative looking at any stage of the illness, and hospice care is that terminal stage of the illness, providing the symptom relief and alleviating suffering. Not looking, so with palliative, you can still do full treatments, curative therapies, all those things. With hospice, you've elected not to. We're looking at the comfort care. The teams are the same. You may have different staff, but it's the same interdisciplinary team. And then we're also looking at Part B for Medicare or insurance company for palliative care to be billed to. But Part A is hospice is a Part A benefit. Okay. So we're looking at advanced care planning then. I talked about that in palliative care and hospice care. What are your wishes? What matters most? What do you want at the end of life? How do you want to be? So it's looking at planning what that advanced care may be, looking at treatment options, look at discussing values and beliefs. You just talk about your decisions, being informed about your decisions. We want to give permission for people to talk about these things and to talk about with people who may know, or just if you don't know, to talk with other people, family, friends, clergy, faith leaders, ministry leaders, to having those conversations, and even the neighbors. So as we were preparing for this, I went for a walk before, met with my 92-year-old neighbor who's doing her leaves and her vibrant life. We've had discussions before. She kind of talks about when she's ready, she's ready. So it's being comfortable with those discussions. And then also advanced care planning is about documenting your wishes. And so we'll talk about that here in a minute. And the philosophy of advanced care planning is to educate about advanced directives. So we'll talk about what advanced directives are, and given that informed decision, we are also looking at brief and bereavement support. Philosophy looks at advocating between the patient and medical providers, and it's a coordination of care of services that may be available. And again, asking what matters most, what's important. And so we have a little video to watch about, it's from the Conversation Project, and let's talk about it.
The Conversation Project is dedicated to helping you and your family talk about your wishes for end-of-life care. Sharing your wishes can bring you closer to the people you love. It's really important, and you can do it. Need a little push to get you started? Consider some facts. According to a national survey we conducted at the Conversation Project, 92% of Americans say it's important to talk with their loved ones about their wishes for end-of-life care. But only 32% have had such a conversation. Turns out, what we say isn't always what we do. And when it comes to having the conversation with our doctors, the gap is even bigger. 80% say they want to talk with doctors about their wishes for end-of-life care, but only 18% report having had this conversation with their doctor. So, what's holding us back? 21% of Americans say they haven't had the conversation because they don't want to upset their loved ones. Well, get this. More than half say they'd be relieved if a loved one started the conversation, and nearly all Americans say they would be willing or want to talk about their wishes for end-of-life care. Have you had the conversation? Our Conversation Starter Kit has helped hundreds of thousands of people talk. Download it for free on the Conversation Project website and get started.
Okay, so this is one way to get started, and we'll share many resources, but the Conversation Project is a great resource. They have it directed for congregational, for clergy, faith leaders, and such. So when 18% only talk to their doctor, but 92% would like to talk about it, we could start talking about it at the congregational level, out in the community, before they get sick. So with advanced care planning, it allows you to manage your wishes, to have those conversations. Advanced care planning is not required by law, although there are some laws around the advanced directives, and so we'll talk about that here next. So the different types of advanced directives, and so advanced care planning, we're talking about several of these things. The primary is looking at the healthcare representative appointment. A lot of these are state forms. They're on our website. You can see it here. But we want to know who is going to speak for you when you cannot speak for yourself. So that's particularly with our times of COVID. To come into the hospital, family members can't be there. Who's going to speak? And the person can't speak for themselves. So we want to have this, and this is something we can talk about before a person's even sick, and even a person over 18 years of age can have this healthcare representative appointment. Who will speak for you? Who's the surrogate? And that person you're going to choose, you want to trust that they're going to follow your wishes. There's also the living will that came out years ago that most people are familiar with. Out of hospital, do not resuscitate. So when you're in the hospital and you say you don't want to be resuscitated, that's fine. They'll mark it as an order. But when you're outside the hospital, there are forms then to protect your wishes that way. The post is rather new from 2013 or 2016 of doctors documented orders of what your wishes are. You can also use the elder law attorney or any attorney to help with power of attorney, but you want to be sure to get a health care proxy. And then talking with your family or physician, they may have resources or advance directives available. So the healthcare power of attorney is a document that, as I said, helps who you will speak for you when you can't speak for yourself. If you can, you speak for yourself, but these are decisions that you want to have them know about. It could be anyone over 18, a family member, close loved one. So it doesn't have to be your family member. It could be a close friend that you would have, but someone you would trust that knows you and will advocate in your behalf. So, and they will honor your wishes. So you don't want to get someone who says, I don't know that I could say, do not resuscitate. Well, you might want to think about and talk about that more. A living will states treatments that you want or don't want, what kind of treatments, like for CPR, nutrition, be on a respirator. So you're able to do this even before you're even sick. So most people have had living wills, like, no, I don't want to be on the ventilator, and they've marked that. That will help direct the person, the healthcare representative, to make those decisions if you can't speak for yourself. Then we, like I said before, we have the out of hospital, do not resuscitate. So several people with a serious illness knows that they have a limited time and they want to allow a natural death. So there are forms to protect. It needs 2 witnesses plus a physician as sign in as an order, and you would give it to, the person would give it to the paramedic, and they would not resuscitate them, take them to the hospital, but they would not have resuscitation. The post is a legal document also that documents the orders of what, and it's for across the care setting. It's usually a bright pink paper. So it goes a little further than just do not resuscitate. It talks about nutrition and other kind of treatments. And there are many tools then to help. As you saw, the Conversation Project was one of them, but there's the booklet 5 Wishes, which is pretty comprehensive and looking at whole person of having helps that conversation with your family members. So you could get that document or that booklet and talk about it. There's Go Wish cards that you can kind of play a game with your family. At Holy Cross, we had senior group, and so I got a deck of cards for everyone, and we played the game choosing how we would want to be at the end of life. So you would talk about it. You don't have to wait for that serious illness. We talk about the young adults. There could be a serious accident. You want to kind of know what they're thinking, what they want. You may have to be their advocate for them. And it helps guide that person who is the advocate, the surrogate, the healthcare representative of what they want, because you've already had these conversations. And it gives peace of mind to the loved ones, the ones making these decisions. So we want to plan ahead, again, finding out what matters most, who's going to speak for you, what are your concerns, what's your what gives your life meaning and purpose, what are your wishes, do people know. It's also helping with the healthcare providers what you don't want. So you want, if you know you do not want something, you can clearly have that documented and have that talked about. And again, looking at one way is looking at one thing that you want to be sure your doctors and your friends know about your wishes. And it's never too young to begin thinking about these conversations. It's very, very helpful. They're intimate conversations. They're sacred and profound. Sometimes they're touching and emotional, but they're very helpful. We can't predict the future, but we can say what our wishes are now. And at any time, we can change what we wish and think, because our life is evolving and different things are happening. So there you go. So in summary, it helps you manage your future health care when you can't speak for yourself. and for your friends, your family, physicians to know your wishes. Talks about and think about your values and beliefs, your decision and wishes, what kind of treatment options are out there, your goals of care. And again, it's not too late to begin this. We have another video to show. This is kind of how do you choose your healthcare representative?
Be your healthcare proxy? Like if you need someone to tell the doctor what to? I just go with whatever the doctors say. I wouldn't want to bother them. They're so busy. Doctors know best, right?
Be your healthcare proxy? Sure, I'd be happy to if I'm in town. Check out my Instagram pics from Peru. Wish you were here.
Oh, I could never let you go. I can't even throw a plant away. As long as it's got one little green leaf. I'd be like, can't we upload her to the cloud?
Well, heck yeah! I've given this a lot of thought. Let me tell you what decisions you're best off going with. You never let them resuscitate you. And if they even try to hook you up to one of those breathing machines, never! I got this! I totally got this!
How can you even talk about this? I can't, okay? I just can't. Mom, it's not like you're gonna die. No! I can't talk right now.
Oh wait, did I show you that meme from iFunny? The cat and the dishwasher? Oh my gosh, okay. So the cat's like, bleh. And then he's like, wah! Oh wait, sorry, what?
Well, hon, you and I have been through so much together. Here's what we'll do. We'll sit down, we'll get a cup of coffee, and you tell me what matters to you.
Well, it wouldn't be easy. I mean, I'd be sad, but I'd have your back.
I remember when we went through this with Mom, we really spoke for her. So I think I can do that for you. Let's talk about what you would want.
Okay, so that kind of gives an idea of starting those conversations. There's a lot of resources online to help. This is another one of the One Slide Project with these questions. Bring it to your Thanksgiving dinner. Put it in a bulletin insert at the congregation. So starting that conversation at the congregational level is a great way. So and I think Lori, are you up next, Lori?
I think so.
All right. So Lori will share resources and her project of looking at this evidence base and different opportunities for congregational health.
Yeah. Thank you, Jan.
Thank you.
So, thank you, everyone, for taking the time to really consider a really important topic, especially in the midst of all the uncertainties with COVID-19 and how that is unfolding in our communities. And what I was asked to do is tell you a little bit about my doctoral of nursing practice project, which culminated in an advanced care planning training tool. And what we did was I worked with Jan at the Franciscan Parishioner site, and we looked at all the resources, including the Conversation Project and some of the things that Jan had mentioned. And we tried to pull together a document that's kind of portable and adaptable for faith communities to use to advance this conversation. And so we really wanted it to make it practical. What you see on the screen here is just kind of a table of contents, but what I'm going to do is I'm going to stop sharing for just a moment, and I'm going to pull up the training tool so that I can give you a kind of an overview of what's in there, and then I'll highlight some of those things that are there as well. And then we can entertain questions. So again, this is the tool. The whole purpose of my DNP project really was to look at if we give resources to health ministers, faith community nurses in faith communities, do we increase knowledge of advanced care planning, self-efficacy, and also do we increase the outreach activities that are taking place? And outreach activities, as Jan so well told us basically it's a continual process. So an advanced care planning discussion is not one discussion that happens in one point in time. It's something that is continual. And so as you saw in the data from the Conversation Project, a lot of people are interested in doing it, but we really don't always know how to start. And so if you look in the training tool here, and I'm going to scroll through and hopefully everyone can see that, there are some evidence-based tools here. So if you're someone that wants to know what are the statistics, how do I know this is important, that is included. But I want to point out just a little bit here about the role that faith communities specifically play, and it's well documented, and the references are here. But you know, one of the things that I found out, and I know as a nurse practitioner, is 87% of healthcare professionals are uncomfortable as well. So we're in good company here. So not only do people sometimes struggle with a topic, but also the healthcare providers struggle with it. And so what does the faith community nurse or the faith community, what is the role there? Well, you know, in our churches and our synagogues and parishes, we walk beside people in all sorts of things. And, you know, that spiritual component of it, the big questions about existential, you know, what is the purpose of life? What matters most to us? What does our doctrine tell us? Tells us that there's a unique role that faith communities can play in filling the gaps in this care. So you see people want to talk about it, but healthcare providers are uncomfortable with it. People don't often approach it, so the healthcare providers may not even approach it at all times either. So we want to kind of be thinking, how can we do that? And so I just want to point that out, that there is a role to play. So in the tool that you see there, there's lots and lots of resources. So on the right here, there's some videos and some podcasts that can help you kind of get your brain wrapped around this if you yourself are struggling with the topic. So that is available to you. The other thing I want to point out is in the tool itself is we've arranged it so that we have kind of 3 levels of starting. So if you are someone who doesn't have a lot of time, but you think this is an important topic, we have really a starting point for you, and we call it the basic start, quick start guide. So you could, as easily as following step 1, which is praying about it, selecting one of the following videos. In this case, they're like 2 minutes long, and some of them are the similar videos that Jan showed you. And then step 2, just meeting with your church leadership to find out what video would be appropriate. Can we do a bulletin insert? Can we send out an email about the topic? And then we have some pre-made bulletin inserts and emails for you to send, and all of this information, much of it is from the Conversation Project, which you can also access, and that's referenced here. We also have, if you have a little more time, we have something called a Steady Start Guide. And again, it just gives you really quick and easy tools to implement at your place of worship so that you can begin this conversation and help people start navigating that. One of the things that we do sometimes is a health fair table or that sort of thing. Of course, now with COVID, that might be a little more difficult to do, but you might host some sort of a Zoom meeting and arrange it around something called National Healthcare Decisions Day, which happens in April, where you could gather people together to have a conversation. Now, if you're someone who's extremely interested in the topic and you have some time to invest, there's something we call the Advanced Start Guide. And in the toolkit, it gives you some additional resources such as Respecting Choices, which is a training curriculum to help you become a facilitator of advanced care planning conversations. So lots of options for you if you have just a few minutes versus if you want to spend more time. But that's one of the things we wanted the tool to be, is very practical. The other thing I want to point out in the tool is lots and lots of resources, and some of which, like I said, Jan has already mentioned. So here's an example again from the conversationproject.org. You can go there right now if you wanted to and check it out. But this is an example of a 5-part education and discussion series on end-of-life planning that one particular church pulled together. And you can see here they arranged for 5 different topics. They had details on that. I think one of the churches made little buttons. They called them, you know, I'm prepared, and they really kind of wrapped around and did a whole discussion about it. Other churches you'll see here, for example, the Bethel AME Church in Boston, they did a planning ahead ministry that infused end-of-life wishes and planning and in a 3-part program. So there's examples of what other faith communities are doing around this work and how that might be something you're interested in doing. One of the things that I was recently introduced to is an author by the name of Hattie Bryant developed she has a book called I'll Have It My Way, and then she amended that to a Bible study. And this is a 6-week Bible study, or 6 parts, I guess, and it's called I'll Have It God's Way, Living Fully Now and Into Your Forever. And it really infuses the Christian concepts about advanced care planning and helps kind of walk people through the processes of doing that. So that may be another option for your faith community to incorporate a Bible study, just to get people thinking about it and talking about it. And certainly within the training tool that we developed and we're disseminating are forms, like Jan mentioned. There's the healthcare representative form. This happens to be the Franciscan Health document, but you can also get those online, like Jan mentioned, at the indiana.gov site. There's lots of downloadable options from the Conversation Project for Healthcare Proxy, including brochures that are free. And they also have them in a variety of languages as well. So I'm going to scroll through here a little bit more. There's a kit, a conversation starter kit that you could download as well from the Conversation Project. Again, a whole list of languages from Portuguese to Hebrew to Chinese. It looks like when I printed this, coming soon was in Arabic. So we have lots of options here. The other piece I want to point out in the training tool, we felt like it was really important to include specific information for clergy, leadership, and healthcare ministers. And again, I'm pointing you back to the Conversation Project because they've got just chock full of things, but they have a getting started guide for faith for congregations. They also have some really good videos that you can send to your church leadership about why this might be an important topic to consider. And then I also included from the Christian tradition and the Christian Bible, biblical references to planning. And one of the stories I heard from a South Carolina pastor who was at a conference, he said, you know, that Christ mentions preparation for his death and resurrection and suffering. And he mentions this and trying to prepare the disciples for this, what was coming. And even in the scriptures, it talks about Peter didn't want to hear it. Oh, no, that can't be true. And in that scriptures, it says, you know, get behind me, Satan. You know, so Jesus rebuked the disciples because they didn't want to talk about it either. So, you know, here we're saying, you know, people don't want to talk about it. The disciples didn't want to talk about it. Healthcare providers don't want to talk about it. And so if we're all a little uncomfortable, it's because we're in good company. But here's a list of some of the scriptures that I found in my own study to kind of support the concept of being prepared. And, you know, out of Luke, it says, nevertheless, I must go on my way today and tomorrow and the day following, for it cannot be that a prophet should perish away from Jerusalem. For me to live is Christ and to die is gain, out of Philippians. And so there's lots of doctrine in the Christian tradition and Bible referencing end-of-life planning and being prepared. The other thing I want to mention to you is in the resources there's some cultural considerations. And this is certainly not exhaustive, but depending on your faith tradition and the cultural group you serve, you're probably well aware of some of the beliefs and traditions and practices that might create some barriers here, but here's some examples for you to take a look at. We do have some differentiation as well about how to get palliative care resources and how to get a hospice provider. So we certainly, as you start conversations, if people aren't sure, there are places you can refer them to. If not just their provider to have the conversation, but there's some additional websites that you can point people to if they're wanting to go a little bit deeper in the conversation. We touch on barriers to advanced care planning as well, because certainly, like I said, lots of taboo around this topic. We found that, excuse me, just a lack of awareness about advanced care planning is some of the barriers. For example, some people think when they get their documents done with their lawyer that maybe a power of attorney encompasses this advanced care planning, and that's not always the case. Sometimes that document does include a healthcare proxy, and sometimes it doesn't. But even if there's a healthcare proxy designated, does the healthcare proxy know it exists? So remember, advanced care planning is this fluid process that happens over a period of time, and we have to revisit it often. Other barriers that we found that we present in the tool, just fear, mistrust of the healthcare system, all the concepts of taboo. And then there's a lot of struggle and a disconnect between law and ethics that propel fetal care. And there's a lot of evidence in the toolkit if you want to read more about how those things compete sometimes. Sometimes in medicine, just because we can doesn't always mean we should. And I think that's something that people struggle with as well. So again, the medical community sometimes engages in futile acts of care that prolong suffering, and a lack of understanding of something called the Patient Self-Determination Act that came out in the 90s. So a lot of solutions to the barriers though, and that's just communication. It's talking about it with your family members and being aware of it. And the final resource I want to point you to that's within the toolkit itself is COVID-19 specific resources. Again, this particular page comes from the Conversation Project. And we know that in COVID-19, this is a big impact. People are thinking more about the mortality. People are starting to have conversations about what if I get COVID-19 and what if I can't speak for myself. And you may see and sense those in your churches and congregations and faith communities, and you want to be able to point people to get more resources. So you can say, here's the website, conversationproject.org, and it kind of walks people through how to make a decision about picking your healthcare decision maker, like Jan mentioned and the video said, how to talk about what matters most to you. And just recently, I had a couple that I was working with in my role as a palliative care provider, and they were at home, and the husband had a lot of serious illnesses and chronic problems. And the discussion centered around the last admission. She was not able to be at the bedside with him because of COVID-19 and the restrictions to the visitor policy. So they formulated their advanced care planning discussion around the concept that they did not want to be a part. And so what did they need to do in preparation for if he went, not if, but when he became sick or had another exacerbation, where did they want that to occur, and how did they want to navigate that? Because the COVID restrictions are uncertain, and we see that unfolding every day as we get new evidence in that. The other resources you'll see, this is additionally from the Conversation Project, the back side of that form, but just walks you through questions. What's most important? What are you worried about? What is helping you through the difficult time? That sort of thing. Helping people to identify what their source of hope is. And then this resource is from the Respecting Choices website, and these will all be linked for you in the presentation, and I think we're going to be posting that. Someone's going to be posting that on the website as well, but these are from Respecting Choices, and you can see there are lots and lots of clickable resources. So proactive care planning for COVID-19, proactive care planning for healthcare agents related to COVID-19, medical priorities and treatment options. And some of this is very medically focused, but I think it's important, again, as healthcare, or as in the faith communities rather, if you're starting to re-engage with people, or people are calling you and they're in the midst of these decisions, at least having some resources to foster it, to continue the conversation and pointing them in that direction. So I'm going to stop sharing this screen for just a moment and go back to our little PowerPoint presentation. And let's see, I think I just didn't do that quite right. And that part is not as smooth as I'd want it to be. There we go. So the next piece that I want to really just kind of end my part of the talk with is a consideration for an action plan. So you've heard Jan talk a lot about documents, palliative care, hospice care. You've heard me share this tool with you and some ideas and some resources on how to maybe get folks engaged, or at least being better prepared for yourself. But I would just encourage you to begin thinking now, what's your action going to be? Have you yourself completed a healthcare surrogate form? If you haven't, start reflecting about why that might be. How can you start a conversation within your own house and family and among your friends? Jan mentioned, this is the holidays, and she gave you that tool that you could start these conversations over Thanksgiving dinner. I personally, a couple years ago, took healthcare surrogate forms to Thanksgiving dinner and passed them out, and I had a couple people wanted to talk about it, and some thought it was not the they weren't ready for that, and that's okay. Again, it's about fostering a communication, starting a conversation. And so after you think about what can you do for yourself within your own sphere of influence in your own families, do you have a healthcare surrogate? Have you thought about what kinds of treatments you would want to have or not want to have? The next piece is, how do you expand that to your congregations and churches and faith communities? Is it time to maybe send an email, or maybe host a Bible study, or set up some sort of a virtual table or something like that? So I want you to consider an action plan so we can kind of keep the conversation going. So I'm going to pause there, and I guess, Jan, if you'll come off mute, we can see if there's any questions. I don't know if there's anything in the chat, but that's all I have for now.
Does anybody have any questions or any comments or any thoughts, reflections?
Anybody have any questions that they want to type into the chat? I am monitoring that, so if you would like to do that, I can bring those questions forward. And we just thank you so much, Jan and Lori, for sharing all this great information. And yes, it is a difficult conversation to have, but just these tools are just really great. While we're waiting to see if anybody else has any questions, I have.
There was a question, is it available in Spanish? I would say the training tool that Lori has is not in Spanish, but at the Conversation Project and other places, there are multiple, as Lori had mentioned, languages. And so yes, in Spanish.
Yeah, definitely the Conversation Project and Respecting Choices. They have robust tools for you. And many of the resources are in Spanish. And then if you go to the Indiana.gov site, the actual advanced directive forms are available in Spanish.
And I have a few of those available. I have resource for those. I worked in a Hispanic community at St. Philip Neri, and so we utilize those there.
So a question that I have, Jan and Lori, are what are some of the barriers that you've encountered or that you might be able to enlighten us with so that we could overcome those with our work in the faith communities?
Well, the primary barrier is no one really wants to talk about it, but I think people think about it all the time. So how can we start opening those conversations? So one of the things I do, because I've been around death and dying, and even with children, so it's not that I'm comfortable with it, but so I was at a retreat in Oldenburg not long ago, and one of the sisters, 90-year-old sisters, said she had this diagnosis. She goes, "It's my ticket to heaven." So I just kind of open with that. What do we think about, a disease as a ticket to heaven because of our faith? So that's why I think it's important to have, to help identify what those barriers are for a person, and then help talk around them and see what's underneath it.
Yeah, and I would just add to that too, Jan, that the barriers that I've seen, in addition to what we've kind of discussed, is, the idea of, the spiritual struggle that people have when they get a serious illness can create a lot of reflection and thought. And, some people that I've worked with that have a cancer diagnosis sometimes are wanting to focus on treatment, which is wonderful. And there's such amazing options and treatments available for folks. And so one of the barriers I've seen is people feel like if they start talking about advanced care planning, that somehow they're giving up hope, that, oh, I have nothing else, and so that's all I have left. What we're trying to suggest is advanced care planning is for all of us in this room, even people without a serious illness, at minimum having a conversation about who your healthcare surrogate would be, and beginning to think about what kinds of treatments you may or may not want to have. But the barriers I've seen sometimes is people don't want to talk about it because they think it will hasten a problem, or that they're somehow abandoning hope. And so I think, redefining what hope is, learning to live fully every day, because we know tomorrow's not promised, whether we have a serious illness or not having one, and trying to integrate that spiritual aspect of it in relation to hope.
And I think another barrier is particularly maybe looking in the congregational faith leaders, etc. I'm not an expert at that. I don't really know. Lori had mentioned to get comfortable with yourself in choosing your healthcare representative, having those conversations with your family. but there are a lot of people out there, resources, and I'd be happy to help navigate or advocate for that, of how you can find a guest speaker, someone who's willing to come out. So like at Holy Cross years and years ago, in the beginning at St. Francis, they had, from the spiritual care department, had a chaplain was willing to come to our church after Mass and talk about this. So I wasn't the expert back then, but I found someone to come in. So you can invite people in. A thing very simple is, you know, all those handouts available to put them in a bulletin or send them out your virtual way. So there are resources. You're not in it alone. So there are, you know, ways to collaborate and partner to help with that. Mm-hmm.
I see another question coming in. This is from Ellen Brock. It says, how do you help a family member that has unrealistic expectations in their wishes?
Mm-hmm.
Well, I can take this one, Jan, if you'd like.
Okay.
I think, you know, in the setting of a faith community, I think it's important to listen and be present with people, to just to offer yourself in the sense of understanding where they're coming from. As a palliative care professional and specialist, you know, we have a different kind of role, but in a faith community role, I think just listening to people and trying to do this communication so that you're, you know, I'm hearing you say, like to a daughter, for example, I'm hearing you say you're really concerned about your mom, and, you know, looking at the mom or the patient in this case, and say, you know, how are you feeling about what she's saying, and just trying to facilitate the two of them to have a conversation. I think that's really important, because sometimes people just need to be heard, right? We go way back to our basic communication skills. Some people want to be heard. And sometimes I've seen, you know, family members think they're protecting the loved one who might be making decisions, and vice versa. I've seen moms that are ill taking care of daughters, and daughters trying to take care of moms, and they both are not saying what they need to say. Mm-hmm. And just giving space for feeling scared, giving space for not understanding it all, and just whatever you can do to facilitate the two people or the family or those connections to talk, because our role is just to always promote that.
And our role is that support and listening, not to make the decision for them. And so to have a judgment that it's a bad decision or it's unrealistic, it's their decision. So we walk with them in their decision, and perhaps there's something underneath it that we don't know about. Yeah. So that being present, I think.
And certainly bringing in resources. If you and your role in a faith community are identifying that a family is really struggling with decisions, or they're really in conflict, to be quite honest, and we see a lot of that, knowing how to get them connected, either referring them to their provider to get a palliative care referral so they can have a specialty team come in and just walk with them in another sort of way to navigate those expectations a little bit better, to help them be educated. And depending on your experience, you may feel more comfortable doing that. I mean, if you certainly decide to engage in additional training, or you've got experience, you've done, say, respecting choices training, you might feel comfortable engaging in some of that family meeting discussion kinds of things. But if you're not, where do you send them? If they're really in conflict and you've listened and you've made yourself present and you've given them support, how do you get them connected to someone who can help them navigate what are just really probably some of the most difficult decisions families ever have to make about these life decisions?
Then also, being faith-based, we will ask the question, where is God in all this? So, and then that trusting God is directing and listening and being part of all that, even though we feel it may not be a good decision or unrealistic decisions and choices that are made. It's not for us to say, but it's between them and their God, and we just walk with them, we be present to them, we accompany them, we abide with them. And not to be shame-based and to say they're wrong, but just, you know, and if we are struggling with a bad decision of a loved one, we need to step away and find our resource to help us, not so we don't impart that onto the person. But where's God in all this? And trusting that the God of goodness and hope is right there in the midst of this decisions. Yes.
We have another question, comment coming in. This is from Lucy. And she says, to start the conversation, I had a relative who loved coffee. He was a lower level for thinking. I told him if he had a breathing tube, he would not be able to drink his coffee. He immediately said, no, I don't want it. I helped him to have this conversation.
Oh, wow. So you met them right where they were, Lucy. So that's the other thing was when you're starting a conversation, meet them where they are and start at that point, not take them somewhere they're not ready to go, but to have. So that's very creative.
I agree. Well done.
Any last questions or comments that anyone would like to share or to ask our experts, Jan and Lori?
I want to thank Lori for this opportunity to work with her in this project, and it will continue on even when you graduate and you're finished with your project. But it's been a great opening, and I appreciate it, and the opportunity for Indiana Center for Parish Nursing and Health Ministries to have a forum for us to share into our faith groups about this project and to reach out. So to say that I would be available, Lori's in Florida, but she's still available as a resource because we're all virtual anyways. But I'm interested in helping advocating and navigating for anyone who has questions. I don't have the answers, but I can help navigate.
Thank you, Jan and Lori. I would like to also just thank you all for being here today. And just be on alert. We don't have our next education series program scheduled yet, but it will be forthcoming and it'll be after the first of the year.